Most people believe high blood pressure is just a normal part of aging. But after treating patients for more than 15 years, I can tell you that's one of the biggest myths in modern medicine. What if I told you there's a simple 10-minute routine, backed by science, that can help support healthier blood pressure naturally? And the most surprising part? Most doctors never explain it. Stay with me, because the final step is one almost everyone gets wrong, and it could make all the difference. I'm Dr. Ethan Cole, a senior health physician with over 15 years of experience, helping patients prevent heart disease and improve cardiovascular health. Throughout my career, I've seen thousands of people rely solely on medication while overlooking simple daily habits that can dramatically improve their heart health. Let me be clear. I'm not against medication. If your doctor has prescribed it, continue taking it exactly as directed. But medication controls blood pressure. It doesn't always address why it became elevated in the first place. Today, I'm going to show you a practical 10-minute routine supported by clinical research that targets 3 major factors behind high blood pressure: stiff arteries, an overactive stress response, and poor hydration. Before we begin, if you enjoy evidence-based health advice explained in simple language, subscribe to the channel and turn on notifications. Every week I share practical medical tips to help you live a healthier, longer life. Now, let's get started. High blood pressure is often called the silent killer because it rarely causes symptoms in its early stages. You may feel perfectly fine, while increased pressure quietly damages your arteries, heart, kidneys, brain, and eyes. By the time your blood pressure consistently reaches 140, 150, or even 160, those changes may have been developing for years. One reason this happens is that our arteries naturally become less flexible as we age. Imagine a brand new garden hose. It's soft, flexible, and water flows through it with ease. Now picture an old hose that's become stiff and brittle. The same amount of water creates much more pressure inside it. Your blood vessels behave in a very similar way. As arteries lose elasticity, your heart must pump harder to move blood throughout your body, causing blood pressure to rise. While walking, eating a balanced diet, and reducing sodium remain excellent habits, they don't always directly improve arterial flexibility, especially after the age of 60. That's why today's routine focuses on something much more specific. The first step involves isometric exercises, simple movements where your muscles work without repeatedly moving your joints. They may look easy, but research has shown they can produce remarkable improvements in blood pressure. A large scientific review published in the British Journal of Sports Medicine compared different forms of exercise and found that isometric training consistently produced some of the greatest reductions in blood pressure, even outperforming traditional aerobic exercise in many cases. So how does it work? When you hold a position like a wall sit or a plank, your muscles remain under steady tension. Blood flow temporarily decreases, and when you relax, fresh blood rushes back through your arteries. This repeated cycle encourages your blood vessels to become more flexible and responsive over time, reducing the resistance your heart has to pump against. Here's the routine. Start with a wall sit by placing your back against a wall and slowly lowering yourself until your knees are comfortably bent. Hold the position while breathing normally. Never hold your breath. Next, move into a forearm plank. Keep your body straight, tighten your core gently, and continue breathing slowly. Finish with one more wall sit. The entire sequence takes about 6 minutes. If you're just starting, don't worry about holding each position for the full time. Begin with 30 seconds and gradually increase your endurance every week. The goal isn't perfection, it's consistency. If you ever experience chest pain, severe dizziness, or unusual discomfort, stop immediately and consult your healthcare provider before continuing. Now that you've helped your arteries become more flexible, it's time to focus on something equally important: your nervous system. Because even perfectly healthy arteries can struggle if your body remains stuck in a constant state of stress. And that's exactly what we'll tackle in the next step. The second part of this routine may seem even simpler than the exercises, but don't underestimate its impact. Your body has 2 automatic systems that constantly influence your blood pressure. One is your fight or flight response, which raises your heart rate and tightens your blood vessels during stress. The other is your rest and digest response, which slows your heart, relaxes your arteries, and helps lower blood pressure naturally. The problem is that many adults, especially after 60, spend far too much time in that first mode. Even while sitting quietly, their nervous system remains under low-level stress, keeping blood pressure higher than it should be. Fortunately, you can influence this system with one simple tool: your breathing. Sit comfortably with both feet flat on the floor. Close your eyes and inhale slowly through your nose for 5 seconds. Then exhale gently through your mouth for another 5 seconds. Continue this steady rhythm for 2 minutes. This technique is known as resonance breathing. Research has shown that breathing at this pace activates the vagus nerve, which signals your body to relax. As your heart rate slows and your blood vessels widen, blood pressure can gradually begin to decrease. Best of all, this breathing exercise works perfectly after the isometric exercises because your arteries have already started relaxing. Together, they create a stronger effect than either technique alone. The final step takes just 2 minutes and involves something nearly everyone does every day, drinking water. But how you drink it matters. As we age, our sense of thirst becomes less reliable. Many older adults are mildly dehydrated without realizing it. When your body lacks enough water, your blood becomes more concentrated, forcing your heart to work harder while your blood vessels narrow to maintain circulation. That combination can contribute to higher blood pressure. Instead of drinking a large glass of water all at once, pour about 450 to 500 milliliters and sip it slowly over 2 minutes. Take one small sip every 10 to 15 seconds. This gentle approach helps maintain the calm state created by your breathing exercise while restoring healthy hydration to your circulation. Now you've completed the entire 10-minute routine. 6 minutes of isometric exercises, 2 minutes of controlled breathing, and 2 minutes of slow hydration. But here's the secret that determines whether this routine actually works: consistency. Don't rely on motivation because motivation comes and goes. Instead, connect this routine to something you already do every morning, such as brushing your teeth, making coffee, or eating breakfast. Once that habit is finished, begin your 10-minute routine immediately. Over time, your brain starts treating it as part of your normal morning schedule instead of something extra you have to remember. Another simple trick is to keep a calendar where you'll see it every day. Each time you complete the routine, place a check mark or an X on that date. Watching that streak grow becomes powerful motivation to keep going. It's also important to have realistic expectations. This routine isn't a replacement for prescribed medication, especially if your blood pressure is dangerously high. If your doctor has prescribed treatment, continue following their advice. Think of this routine as a powerful complement to medical care, not a substitute. Scientific evidence strongly supports these strategies. Studies consistently show that isometric exercises improve arterial function, controlled breathing helps regulate the nervous system, and proper hydration supports healthy circulation. Together, these habits address several underlying contributors to high blood pressure instead of focusing on just one. After 15 years in healthcare, I've learned one lesson that stands above the rest. Small, daily actions often create the biggest long-term results. You don't need expensive equipment, complicated workouts, or miracle supplements. You simply need a routine you can follow consistently. So starting tomorrow morning, invest just 10 minutes in your heart. Your future self will thank you for every session you complete. If you found this video helpful, let me know in the comments which part surprised you the most: the isometric exercises, the breathing technique, or the slow hydration method. If you know someone living with high blood pressure, share this video with them. It could be the first step toward protecting their heart for years to come. And if you enjoy practical, science-backed health advice, don't forget to subscribe and turn on notifications. I'm Dr. Ethan Cole, and every week I'll help you take simple, evidence-based steps toward a healthier, longer life. Thank you for watching. Take care of yourself. Stay consistent. And as always, speak with your healthcare provider before making any major changes to your health routine, especially if you're taking medication. I'll see you in the next video.